Hi, I'm Dr. Bruce Van Natta, and I'd like to thank you for your interest in our breast augmentation procedure and rapid recovery program. With 20 years' experience, I can say with confidence that our approach leads the way in patient care, comfort, and satisfaction. During this presentation, I'll explain our rather unique approach to this procedure, the emphasis we put on allowing your tissues to define the ultimate result, the need for realistic expectations, and the goal of avoiding complications and reoperations. Second, we'll take a look at the surgical procedure itself, giving details of the operation and activities on the day of surgery. Thirdly, I'll present the choices of implants that are currently available, as well as those that may be available in the future. The fourth section will involve your post-operative routine, which involves essentially no downtime, no use of narcotics. You'll be able to drive the next day, return to work in 1 or 2 days, just taking Motrin. I'm sure you'll see why we call this process our rapid recovery program. Choosing breast augmentation is a big decision, and we understand all the anxiety and excitement you feel at this time. This is a big choice to change your breasts, your body, for the rest of your life. The best chance to get it right is the first time. Our focus is on you, from the moment you visit our website or walk into our state-of-the-art facility until well after the recovery period. Our ongoing mission has been to provide the best long-term results with minimal disruption of your life. With our unique approach to breast augmentation and rapid recovery, you will shorten or completely eliminate downtime after surgery, relying on nothing stronger than Motrin to ease any discomfort. The bottom line is that I believe in doing what's best for you, not just for today, but for tomorrow as well. And I must say the results speak for themselves. I believe a well-informed patient is a much happier patient. So let's take a closer look at your goals and expectations, as well as the surgical procedure and rapid recovery program.
I started thinking about having a breast augmentation after seeing changes in my body during the aging process and having 2 children, and I really just wanted to do something for myself.
Cosmetic breast enlargement is or should be defined by what the patient literally brings to the table. The final result is completely dependent upon breast dimensions and tissue characteristics, things that have been determined by individual genetics and modified by changes following pregnancy. Remember, this is an enhancement of the existing tissues, not creation of a whole new breast. Most problems, particularly long-term, are attributable to trying to meet the patient's desire for a cup size that's unrealistic, often too large for her body characteristics. In choosing an implant for an individual patient, I envision what volume is required to fill her breast to its optimal volume. Imagine with me for a moment that your breast is on profile here, and I have a pitcher which I can pour volume or liquid into the breast to fill that breast to its optimal volume, not overfill it to a maximal volume. 3 things dictate what that final volume will be. First, the width of the breast itself, not the shoulders or chest wall. Second, the distance from the bottom of the breast to the nipple, kind of the cup of the breast. And thirdly, the degree of stretch present in the tissues. In some cases, you may have 2 women who both wear the same bra size, say 34B. They may even have the same breast width and distance from the bottom to the nipple. But let's say one woman has been through pregnancy, and she nursed and her breast stretched to a C cup. The other woman's had no pregnancy. Her skin's tighter. And that's why these 2 women will ultimately require different volumes to adequately fill their respective breasts. By taking these body characteristics into consideration, we've developed an approach based on realistic expectations. Now, let's take a look at how we can help determine your realistic expectations.
Dr. Van Natta is very straightforward and honest with you, and if you go in thinking you want to be a certain size, he will definitely listen to you, but he will also advise you what he feels is best.
By following this approach, allowing your body to dictate the optimal size implant, a lot of good things happen. First of all, we'll get a natural appearing result because it's your tissues filled to their optimal size. And secondly, it's very unlikely that the additional weight from the implant will exceed what your tissues are capable of supporting over time. By following our method, we ideally get a result that when seen in a bathing suit will cause an observer to pause and think, I wonder. Nice enough to get noticed, but no telltale sign of an implant. Now, I need to warn you, once you become accustomed to the new size, you may find yourself thinking, gee, I wouldn't mind being just a little bigger. And I guess that's just human nature. But realize that we will have selected, no, actually, your breasts have told us what optimal size implant is selected for your augmentation. If we exceed that optimal size, the risk of bottoming out or stretch at the bottom of the breast begins to increase. This bottoming out may occur after a few months or a few years. I feel it's the surgeon's responsibility to guide the patient in this process, to set limits, much as a parent guides her child. If your kids come in and say, I want to go outside and play in the street, you say, no, you can go outside and play, but stay in the yard. You don't allow them to go into the street because you as the adult have the experience and knowledge to realize the consequences of playing in the street. I think it should be the same way with this surgery. It's the surgeon's responsibility to guide the patient. When the bottom of the breast stretches due to selection of too big of an implant, the patient is the one who pays, literally and figuratively. She often has to have additional surgeries, scars, and expense, all of which potentially could have been avoided. The patient should respect the limits defined by her own tissues and not pursue unrealistic desires for an implant size that her tissues have no chance of supporting over time. It's a simple matter of common sense and basic physics. Remember, the best chance to get the ideal result is with the first surgery. Choosing an implant that's too large will overstretch a woman's tissues, and the effect is irreversible. The tissues can never return to their unstretched state. Our approach significantly reduces the need for reoperation, something I'm sure you'd want to avoid. I view reoperations caused by poor initial decision-making on the part of the surgeon as a long-term complication because it was avoidable. Now, I'd like to encourage you to go to our website. There you'll see befores and afters of a lot of different patients, and you're going to notice that there's a difference in the results. Don't pick the after that you think you want to be, but rather pick a couple of befores, let's say, that most closely match you in terms of age, pregnancy history, height and weight, and that the breast looks most like yours. And then go from that before and look at the after. Now, before we go into surgery, let's make sure we understand the benefits of our approach to breast augmentation. By following our approach, where we allow your breast to dictate to me what the final volume is going to be, and ultimately then the size of the implant, a lot of good things happen. First of all, the final result will, by definition, be natural. It has to be, because it's your breast tissues that we've simply filled. Secondly, we reduce the risk that the added volume or weight will exceed what your particular breast is capable of supporting over time. There is always the element of genetic tissue stretch, the elasticity, which is genetically determined, and that's not always predictable. Similar breasts may respond differently to the same size implant in terms of stretch at the bottom of the breast due to the difference in their genetics. Now, about the breast implant itself, let's take a look at the various types that are available today. Currently, we have two implant options, saline-filled and the standard silicone gel implant. The silicone gel was approved by the FDA in the fall of 2005 to again be used for breast augmentation. I've been an active investigator on all FDA clinical trials leading up to the re-release of these implants, and I can tell you they are an absolutely safe and effective long-term option for women who want breast implants. They are the most studied medical devices ever. And as a board-certified plastic surgeon who utilized these implants for 20 years, I am completely comfortable recommending them to the women in my own family. You may have heard discussion about a new implant known as the cohesive gel implant, sometimes referred to as the gummy bear implant. I've been involved in clinical trials regarding this implant as well for several years and hope that it may become available in the next couple of years. Currently, though, our options are the saline or the standard silicone gel. After I've examined your breasts and taken several measurements, we'll discuss which of these implants may be best for you.
I was just very relaxed and comfortable. Everyone speaks to you prior to that surgery, including Dr. Natta, the anesthesiologist. They get you very comfortable, and from that point on, I just remember waking up in the recovery area.
The breast augmentation procedure is performed under general anesthesia, takes about 45 minutes. Patients generally arrive about an hour before surgery and spend 45 minutes or so in recovery. All told, you'll spend approximately 3 hours at our state-of-the-art surgery center. Our procedure places the implant in a pocket created under the pectoralis muscle. As can be seen in the illustration, the pectoralis muscle covers the upper 2/3 or so of the implant in most women. This means that the lower lateral portion is covered and supported only by the breast tissue that the patient has to begin with. You will be able to feel your implant at the bottom and at the side of the augmented breast, not see it, only feel it. Our preferred incision is along the bottom fold of the breast, as opposed to the armpit or at the edge of the areola. The incision in the fold carries a lower complication rate than the other choices. Although it's our aim to avoid reoperations, sometimes it's necessary, and it's far easier through the fold if another surgery is required. And as with all our procedures, your health and safety are our highest priorities. Okay, surgery is complete, and you're now ready for the Rapid Recovery Program. Forget being bound up and drugged on painkillers. This process will have you out and about in no time. Let's find out how.
And he also wants you to do exercises, which are somewhat modified jumping jacks. The next morning I was still a little sore, but once I started those arm movements again, it helped tremendously.
One of the most exciting things I've experienced in my practice in the past 20 years is the Rapid Recovery Program for breast augmentation. It assures a quick recovery with essentially no downtime, no need for narcotics, just Motrin. This program was developed by my friend Dr. John Tebbets from Dallas, arguably one of the most innovative and insightful breast surgeons in the world. His program is 180 degrees opposite of traditional post-augmentation care, which involved wrapping the breast, restricting arm motion, and overall limited activity. With the Rapid Recovery Program, we have you go home, take a 2-hour nap, after which your caregiver wakes you up, gives you a bite to eat and 800 milligrams of Motrin. After 15 to 20 minutes, you get in the shower, wash your hair, blow dry it, get dressed, and then you and your caregiver go out to lunch. But you open your own car door, do all the normal activities. Every hour, you do a set of 5 overhead arm stretches, with the backs of your hands touching high overhead and with the arms touching the ears. After lunch, you go out shopping, to a movie, whatever you like. Just be sure to stretch every hour. That's the key. In fact, most patients soon figure out that they want to stretch even more often because it feels good to do so. At the end of the day, before going to bed, we ask that you lie face down with your full torso weight on your breasts. Now, this may be a little uncomfortable at the start, but most patients find it feels really good after the 15 minutes. And they find that each time they do it thereafter, it feels a little better. We do recommend that you take an Ambien sleeping pill to assure a good night's rest before you go to bed. The next day, you start the process over with a morning shower and hair washing after taking your Motrin, and continue the hourly stretches. You can drive and do all the normal routine activities. We only ask that you avoid the heavy use of the pectoralis muscles. No bench pressing, push-ups, moving furniture, swimming laps, that sort of thing. Otherwise, you may resume running as soon as you feel comfortable, but wear 2 jog bras. You may even do arm exercises such as curls, triceps, deltoids, and even a latissimus pull if you like. Many patients have returned to work in 1 or 2 days, having surgery, say, on a Friday, going back to work on Monday. This recovery program stands in stark contrast to the standard approach that often is described by patients as being worse than childbirth. With the old approach, many of these patients are unable to drive for 7 to 10 days after surgery, but it simply doesn't have to be this way. I invite you to visit the patient comment section on our website and find out what actual patients had to say about their experience with our Rapid Recovery Program. The program will amaze you, your friends, and relatives, especially those who have had experience with the old of breast enlargement. I look forward to adding you to our list of happy patients. Our method for breast augmentation involves a common sense approach that assures a natural result. It allows the patient's own tissues to dictate the optimal size implant selection. This approach minimizes complications and the need for future reoperation. Finally, the post-op program allows our patients to return to normal activities immediately while taking nothing more than Motrin. I have committed myself to offering the very best in breast augmentation in terms of achieving natural, long-lasting results with a recovery that is absolutely as speedy as possible. If you'd like to learn more, please call our office to schedule a consultation. Find out how our approach to breast augmentation with the Rapid Recovery Program can make a wonderful difference in your life. Thank you.